Does head position affect the outcome of hyoid suspension surgery? Have you ever wondered if the way you position your head could impact the success of hyoid suspension surgery? This surgery is designed to treat obstructive sleep apnea by repositioning the hyoid bone. The goal is to stabilize and advance this bone to help keep the airway open during sleep. When it comes to head position, the evidence does not suggest that it plays a significant role in the outcome of hyoid suspension surgery. Instead, the success of this procedure is influenced more by the patient's anatomy, the severity of airway obstruction, and the surgical technique used. For instance, patient selection is key. Those with a lower apnea-hypopnea index, which measures the severity of sleep apnea, tend to have better outcomes. Specifically, patients with an apnea-hypopnea index of less than 30 usually see more success. Additionally, combining hyoid suspension with other procedures, like uvulopalatopharyngoplasty or genioglossus advancement, can lead to improved results. The surgical technique itself is also vital. Advancing the hyoid bone and suspending it to the mandible, or lower jaw, tends to improve airway patency more effectively than suspending it to the thyroid cartilage. This method lowers the pressure in the throat and maintains the hyoid's mobility, which is essential for swallowing. After the surgery, the outcomes, such as reductions in the apnea-hypopnea index and improvements in daytime sleepiness, are primarily influenced by anatomical factors and how well the airway is stabilized. The position of the head does not significantly affect these results. While head position during sleep can influence airway obstruction severity in patients with obstructive sleep apnea, this is different from the outcomes of hyoid suspension surgery. Patients often benefit from positional therapy after surgery to further reduce airway collapse during sleep, but this is a separate issue from the surgical results. In summary, head position does not appear to affect the outcome of hyoid suspension surgery. The focus remains on selecting the right patients, using precise surgical techniques, and addressing any multi-level airway obstruction. So, if you are considering this surgery, rest assured that your head position will not be a deciding factor in its success.